Hello! Today we're going to look at asthma and why we have more of it in our world today. But before we can discuss asthma, what's gone wrong, look at the root cause, and how we can fix it, we need to see what the lungs are supposed to do. First, let's start with the major jobs of the lungs. The first job of the lung is to exchange gases. Remember, carbon dioxide for oxygen. Most of us know that. But there's another exchange that happens when we breathe in and out, and that is an exchange or removal of toxins in the air. The lungs are actually one of the major detoxification organs in the body. They handle most of the fat-soluble toxins that enter our body, and the lungs are the ones that get rid of that. Some of it's through mucus and the cilia action, which we cough up, but a lot of it is actually creating a gas with that toxin and allowing it to be dispelled when we breathed out. Now, we have some problems because we have so many more toxins in our world today. And so many of those toxins are fat-soluble toxins. Plastics have a lot of toxins that are fat-soluble. BPA and all the lists of carcinogens that we have discovered in plastics, many of which are still present even in BPA-free plastics. Those go to the lungs and can damage them or have something for the lung to process. Another category is heavy metals, and we are exposed to more of these. There are heavy metals in a lot of medications, including immunizations. We add metals to our foods to fortify them, and they're not necessarily always in an absorbable form. And there's just metal exposure that we get. The lungs are the ones that generally process those metals and get them out of our body. The last category of things that we get out of our body from the lungs are fat-soluble toxins in fat. Now, the toxins in fat are ones that we have actually replaced with healthy fats with. Trans fats, vegetable oils, margarine, hydrogenized oils, all of these things contain toxins that cause our lungs to have to deal with them. They also damage the lungs, which I keep saying, because the lungs, if there's too much, then the lungs will get damaged by them. And when we don't eat enough saturated fat, which the lungs love fat, and I mean saturated animal fat. That is what causes the lungs to work the best. And when we removed the high-fat diet of saturated fat from our culture and replaced it with margarines, vegetable oils, and other trans fats, then we have actually not only added to the chemical toxin load of our lungs, but we've also taken away some of the lungs functioning because we don't give it the nutrients that it needs. So that's what the lungs do. That's how they're supposed to work, and that's kind of what goes on. So let's look at a healthy functioning lung. What happens when a toxin overwhelms the lung and causes a little bit of damage? So we have a little area of damage right here, which I'm going to magnify. Let's think of this as a roadway. So let's say there's a huge pothole opens up in the middle of a road. What are we going to do? Do we just let the highway continue? No, we stop traffic. So the body does this. It essentially puts cones around this area of damage, and it does that by taking one of these little shoot-offs from the bronchioles and closing it off, just for a period of time, generally about 10 minutes, until this area of damage is fixed. When the damage is done, the body removes the cones and removes the blockage, opening up that bronchiole again, and you can breathe fine. Now, here's where the issue comes in. Because we had so much more asthma or lung spasms happening in our culture because of the toxins and low-fat diets that we have prescribed for ourselves, we now get this scenario. A damage area occurs, the body does the same thing, cones it off, tells us to stay away, and closes that bronchiole. But we don't like this. It doesn't feel good. And so, it's scary, right? And so, we take medication that forces that bronchiole open, opening the highway before the pothole is fixed. The body says, okay, not a big deal, it's just a little bit. We don't have to worry about that. And here's what it's waiting for next time. So the next time we have toxic damage, say here, the body again closes off the bronchiole to here, puts cones around the area, and gets ready to repair. But what do? We take more medication, like albuterol, and force that bronchodilator, force it open. The body opens up. Now we have 2 areas of damage. This continues. We have more and more areas of damage, and every time this happens, the body tries to close it off, and all of the other ones that aren't fixed, it does them all at once, and we keep forcing it open and open and open. This is why asthma is now a life-threatening disease. Asthma used to be considered a benign, self-resolving issue. It would happen sometimes in childhood or sometimes during certain periods of life, probably toxin exposure, but now it is something that kills children and adults on a very regular basis. This is the issue. We have forced the lungs to open up as we've added toxins and taken away the body's ability to heal and repair this damage and function properly because of a low-fat diet. So what do? There is hope. It's great. Now, this one is a little bit long-lasting. If you have very bad asthma, you can't just stop your inhaler. That is dangerous. What you have to do is start from the basics, removing toxins from your body, removing the toxins that you're putting into your body on a regular basis, going back to saturated fats, animal fats, and taking out all margarine, vegetable oils, trans fats, hydrogenated oils, plastics, and trying to limit heavy metal and support your body as it's slowly cleansing. The next thing that we can do is to start slowly allowing the lungs to heal. Now remember, we've gotten into this situation because we kept reopening areas that the lungs have closed. So what we can do is allow, when possible, the lungs to repair that damage. Now it may happen a little bit that you don't even notice. As you increase the fat in your diet, as you get rid of toxins, the lungs may slowly start healing some of these spots and maybe taking a few of these away. The other thing you can do actively is when you have an asthma attack, don't rush your inhaler right away. Keep it by you, but try breathing slowly, staying relaxed and calm, being warm, especially your throat, sipping on something warm. With a child, you can have them sip on a teaspoon of warm water over and over again while you're holding them gently in your lap and reading a book. If it's not a bad attack, maybe you can pass that without medication. If you can do that, then the lung has repaired damage. Success! We're on our way to healing and getting rid of more and more of these cones and spots that are causing the damage. Now, this process can take a long time, months and months to years, depending on the amount of damage that you have and how quickly you are resolving it. So be patient. Do not put yourself in any kind of danger. Keep renewing your prescription of albuterol until you're really sure that this is really gone. And of course, I don't recommend anyone decreasing any medications without talking to the provider first. So there you have it. That is what's happening in the lungs. This is really what's behind asthma. We have too many toxins, not enough fat, and then we force the body to continue on with damage without allowing it to repair. So to reverse that, we need to decrease toxins, increase saturated fat, and allow the body, as it's able, slowly repair the damage. I hope that helps. Please subscribe to our channel. I'd love if you would share this with people that you know that would need to hear it, and thank you for watching.